Hello everybody and welcome to PathoLogic. Today we're going to be discussing diabetes insipidus in veterinary species. Diabetes insipidus is a rare disorder primarily affecting dogs and cats. It results from disturbances in antidiuretic hormone production or antidiuretic hormone response. The main types are central and nephrogenic. Both of these types can also be primary or congenital, or secondary, otherwise known as acquired, due to some disease acquired during the animal's lifetime. The main clinical signs of diabetes insipidus are polyuria and polydipsia, along with a hypostenuric or isoscenuric urine. The polyuria in this condition also persists even if the animal is dehydrated. Now we'll take a little bit of a closer look at the pathophysiology of this condition. Under normal circumstances, the hypothalamus produces antidiuretic hormone and passes it to the posterior pituitary. The posterior pituitary then releases it into the bloodstream. From the bloodstream, ADH reaches the kidneys, where it stimulates water reabsorption by the renal tubules. In diabetes insipidus, there is either a lack of ADH production or a lack of ADH response. Therefore, there is minimal stimulus for water reabsorption. Water therefore stays within the renal tubule, diluting out the urine constituents. This is what causes the hypotonic polyuria that we see in diabetes insipidus patients to develop. The polyuria also causes the animal to dehydrate, resulting in secondary polydipsia. Central diabetes insipidus results from decreased secretion of ADH by the hypothalamus or posterior pituitary. This usually results from compression or destruction of the posterior pituitary gland or hypothalamus. Potential causes include pituitary neoplasms, cysts, inflammatory granulomas, and traumatic injuries or surgery. Nephrogenic diabetes insipidus results from an inadequate response by the kidneys to ADH. Primary nephrogenic diabetes insipidus results from a congenital lack of ADH receptors or a poor receptor response. Secondary causes of nephrogenic diabetes insipidus include drugs, electrolyte disturbances, endotoxemia, endocrine disorders, etc. These factors are all going to interfere with the normal interaction between ADH and the renal tubular receptors, thus leading to diabetes insipidus. Now we will look briefly at diagnosis. The water deprivation test is used to identify whether the kidneys are able to concentrate urine in response to dehydration. To perform this test, owners measure the amount of water that the pet normally consumes at home for a period of 3 to 5 days to establish a daily baseline. Then they reduce water by 5 to 10% per day to slowly induce dehydration. Abrupt water withdrawal is not recommended for this test, so a slow introduction of dehydration is preferred. The veterinarian then checks the patient's urine-specific gravity. If it does not increase with dehydration like you would expect it to, then there must be a disturbance in ADH activity. The main purpose of this test is to help rule out psychogenic diabetes insipidus, where the animal is polydipsic due to some sort of psychological disturbance such as boredom, but they actually do have a normal ADH response. So for this test, we're going to induce dehydration by reducing the animal's water intake. This should cause more reabsorption of water in the kidneys through increased ADH action. In diabetes insipidus, because ADH is either blocked from binding to receptors or is deficient, water continues to be excreted despite the animal's dehydration. The ADH response test often follows the water deprivation test, and it helps to determine what type of diabetes insipidus is present. To perform this test, you give the animal a dose of ADH and evaluate for any urine changes. In central diabetes insipidus, the urine will begin to concentrate normally after the test. In nephrogenic diabetes insipidus, adding more ADH is not going to help the animal respond to that hormone, so the urine stays hypotonic. So since the ADH receptors still work in central diabetes insipidus, adding in the dose of ADH restores the kidney's concentrating ability. This results in a concentrated urine on the urine-specific gravity test. For nephrogenic diabetes insipidus, the kidney's response to ADH is still impaired no matter how much ADH we give that animal. Therefore, water is still not going to be reabsorbed properly, and the urine remains hypotonic despite the animal's dehydration and the additional ADH. So to summarize, diabetes is a rare disorder that results from either deficiency of antidiuretic hormone or a lack of response to antidiuretic hormone. Diagnosis is through a water deprivation test or ADH response test. With water deprivation, urine is not going to concentrate despite the animal's dehydration in diabetes insipidus patients. For nephrogenic diabetes insipidus, the urine will continue to stay hypotonic or unconcentrated, even with the addition of more ADH by the veterinarian. Thank you for watching PathoLogic. If you enjoyed this video, remember to like, subscribe, and to share with your classmates. Thanks again for watching, and we will see you in the next video.